It is funny how we treat our devices like way better than ourselves sometimes. Your phone hits 10% battery, the screen dims, you get a notification, and you immediately scramble for a charger.
Right, yeah, you wouldn't just keep scrolling and expect it to magically stay on.
Exactly. But look at a modern hospital ward at 3 in the morning. You have doctors and nurses operating on 1% battery, alarms blaring, and the expectation is just to keep working.
Yeah, it is a completely unsustainable environment.
It really is. And today we have got a fascinating deep dive tailored just for you. We are unpacking this Malaysian research program called MINDFulgym. The mission here is to explore the hard science of how healthcare workers can actually survive an environment designed to drain them.
And to understand why this specific program was developed, we really first have to look at the severe reality of the clinical environment it was born into. I mean, the Malaysian data paints a highly concerning picture.
Oh, absolutely. The numbers in the sources are wild.
Right, so studies show that between 30 to 60% of healthcare workers experience anxiety.
30 to 60%. And it gets worse the deeper you go into the ranks, right? Because burnout affects roughly 1 in 4 nurses, and get this, over 70% of house officers.
Wow, 70% of junior doctors.
Yeah. That is not just a rough shift. That is a systemic collapse. I mean, trying to heal patients when you are burned out is like trying to pour from an empty cup.
It is, and that kind of chronic unmanaged stress doesn't just stay in the mind, it manifests physically. The research actually highlights a phenomenon known locally as semua sakit syndrome.
Wait, Samua Sakit.
Yeah, which literally translates to everything hurts syndrome. The psychological burden becomes severe physical pain.
Man, that is intense. So because that burnout rate is so staggering and the physical toll is so real, just telling hospital staff to, download generic meditation app wasn't going to fix anything.
No, definitely not. Researchers at University Putra Malaysia realized they needed something hyper-localized. It had to be scientifically validated in actual clinical settings.
So this wasn't just some imported wellness trend.
Exactly. That is how Mindful Gym was developed over the last 15 years. What is fascinating here is the hard evidence they gathered.
Okay, lay it on us.
Well, they conducted 4 distinct studies validating the program for medical students, and then they did 4 subsequent studies proving it works for hospital nurses.
Okay, I have to play devil's advocate here, though. Isn't prescribing mindfulness to a nurse in a severely understaffed ward a bit like telling someone to bail out a sinking ship with a teaspoon?
Oh, I totally get that concern.
Because, it feels incredibly unfair to ask exhausted healthcare workers to just breathe deeply instead of fixing the broken, understaffed hospital system.
The researchers actually completely agree with you on that. The data explicitly states that self-care cannot substitute for systemic organizational improvements.
Right. It is unjust to shift that burden entirely onto the individual.
Precisely. But until those massive institutional changes happen, these workers need a lifeline right now.
Okay, so the innovation here isn't necessarily the concept of mindfulness itself, but the delivery mechanism. They aren't asking a nurse to go sit in a dark room for an hour, are they?
No, not at all. The program shifts away from theoretical teaching and long sessions. It actually integrates self-care into the micro moments of a clinical shift.
Like what? Give me a real-world example.
We are talking about taking a brief, mindful pause while washing hands or doing a specific grounding exercise right outside a patient's door before rounding.
Let us break down the mechanics of that.
Yeah.
Why does a 30-second pause while washing your hands actually do anything?
It comes down to intercepting the nervous system's fight or flight response. When a nurse is rushing between critical patients, their amygdala is just sounding the alarm.
It's flooding the body with cortisol.
Yes, exactly. By intentionally focusing on the physical sensation of the water or the feeling of their feet on the floor, they force the brain to switch gears.
Oh, wow. So it signals the parasympathetic nervous system to hit the brakes on that cortisol release?
You got it. It physically interrupts the stress loop.
So it is self-care on demand. It uses the tiny transitions they are already making throughout the day. And the data from those 8 studies shows this actually works.
It really does. The results show consistent, measurable reductions in stress and anxiety. But beyond just surviving, it also leads to improved happiness and job satisfaction.
That is huge. It gives them back a locus of control in an environment where they often feel completely powerless.
Exactly. It allows them to regulate their nervous system in the exact moments they need it most, rather than waiting until the end of a grueling shift to finally exhale.
That makes so much sense. The evidence clearly shows MINDFULGym is a scientifically validated, locally researched tool that actively improves emotional well-being.
Right. It isn't a cure for a broken system, but it is a proven shield for the people working inside it.
So before we wrap up this deep dive, there's a fascinating concept in the sources about neuroplasticity. Basically, the fact that our brains physically change their structure based on repeated practice.
Yeah, that is a really crucial point to end on.
So here is something for you to ponder. If brief mindful pauses can wire the brain for resilience, what are the permanent physical changes happening to a healthcare worker's brain if they spend decades trapped strictly in mindless high-stress autopilot?
That is a very sobering thought.
It really is. Something for you to mull over until next time.